Welcome to Healthline. I am Sheila Whitkey, your host. Today my guest is Dr. Jane Conley, an allergist, a physician who specializes in the various types of allergies that affect us on a daily basis. Today, Dr. Conley and I will discuss some of the more common allergies. Welcome to Healthline, Dr. Conley.
Thank you.
I'm delighted to have you as my guest today. Allergies are an abnormal response of the immune system. People who have allergies have an immune system that reacts to a usually harmless substance in the environment, which is known as an allergen. Allergies are a very common problem affecting at least 2 out of every 10 Americans. For example, hay fever affects 10% to 20% of the United States population and is the most common allergy in this country. Before we discuss allergies in detail, I want to first begin by defining a few terms that we'll be using throughout our show today. Dr. Conley, would you define the following terms?
Okay.
For example, allergy, allergen, I know they sound awful familiar or similar, antigen, and also an antibody. What do we mean by when we talk about those?
Well, an antigen and an allergen, for our purposes, are almost the same thing.
Mm-hmm.
They are the substance, usually a protein, that the body's reacting to. So common examples would be the dust, the mold, that type of thing. The antibody is actually the body's response to the antigen that primes the body to make a response so that when they see, say, the ragweed is inhaled, then the response can be made.
Okay.
So the antibodies are substances that are floating around in the blood, if you will, sort of waiting for the allergen to come.
Okay, and
Okay.
To fight it. Okay.
Mm-hmm.
Now, what really happens then when you have an allergic reaction to, say, an allergen?
So if you, let's use the example for allergic rhinitis or asthma, if you inhale something to which you are allergic, and that antibody is attached to an allergy cell, and it matches, say, the ragweed like a key in a lock. And when that key goes into the lock, the allergy cell spews forth its contents that cause all the problems that we see, the sneezing, the itching, the congestion, runny nose, those types of things. For example, histamine.
Mm-hmm.
Histamine is a very common chemical mediator in our bodies that causes those symptoms, and that's why we take antihistamines such as Claritin, Zyrtec, etc., over the counter to counteract that.
Okay, okay, good. Allergy symptoms can be categorized as mild, moderate, or severe, and severe is often caused anaphylactic, which is very, very serious.
Mm-hmm.
Doctor, would you just describe the symptom of each of these characteristics? And I know they can vary from person to person too.
Certainly, certainly. And well, and oftentimes one person may have different severities at different times of the year, but mild symptoms, I would say, would be things that are easily dealt with: a little sneezing, a little itching, a little runny nose. Maybe you can take some over-the-counter medications and solve that problem without difficulty. Moderate, perhaps you're at your primary care doctor getting some help with that, maybe taking medications on a regular basis, having some occasional problems such as sinus infections or maybe an asthma exacerbation, but still something that can be controlled. More severe patients can be hospitalized. They can need to go to the emergency room with asthma attacks, which can be life-threatening. Sinusitis is particularly severe in our area, such that people can have antibiotic usage for long periods of time or have difficulty staying off antibiotics because they either can't clear one infection or they keep catching infections repeatedly.
Yeah, okay. Who usually develops allergies? We hear a wide gamut of a lot of different people, but basically who would you say develops them?
Well, they're more prevalent in young people, but of course if you've had them all your life, you're liable to keep them as you get older. They run in families. That's the biggest factor. There's a few genes that are carrying the allergic diseases, and that's not entirely worked out specifically yet, but we know very definitely they run in families. And so you may not have the exact same allergy For example, your mom might have allergic rhinitis and you might have asthma, but all of those allergic diseases tend to run together in families. So if you take a family history, you'll see different family members will have all those different combinations of allergic diseases.
Okay. When should we see the allergist, the specialist? When should we go take care of that?
Well, I think if you are easily controlled with either over-the-counter medications or medications that your primary care doctor gives you, and you just have symptoms a few times a year for a short period of time, you probably don't need the allergist.
Okay.
I would like to see the people who are not responding to those first-line medications, particularly people who are having sinusitis that isn't responding, because that can be due to underlying allergies, or it can be a chronic infection that's not being cleared and needs a little bit more workup, like for example a CT scan. Asthma patients, particularly if they are at least moderate severity, need to get breathing tests at least on a yearly basis, because there are problems with the airways that people can't feel. And the only way to detect those and make sure their airways are preserved in the long term is to do those breathing tests. So those types of things are the people that should come to the allergist, so that we can really pinpoint what they need to be doing and avoid spending time on things that maybe are not important. You know, they may be working on their mold problem when they really need to be working on their dust problem.
I see, yeah. You alluded to the fact and gave an example of asthma, and you mentioned earlier when we were saying that usually they're inherited. A lot of the allergies tend to be from the parents. I'm going to ask you a question that is probably an old wives' tale that we've often heard growing up, is that does asthma usually lessen as one grows older, and do they not have the asthmatic symptoms that they did as a child, or is it the same?
Oftentimes it does. It is individual. Certainly there are plenty of adults who have asthma and have had it since childhood, but oftentimes it does get better. There's a lot of factors with young kids that cause them to have a tendency to wheeze. A lot of those infections that they catch when they're young, the body's getting used to those germs, and once it's produced an immune response and has seen those germs before, then they don't get sick as often. It doesn't provide as much of a stimulus for asthma attacks. And so, yes, they usually do get some better, but there's other factors, like for example, if they have chronic sinusitis, that will keep asthma going, so that's why it's so important to control that. Another thing I like to tell people is, even if a young person has outgrown their asthma, always keep an inhaler around just in case.
Wonderful.
Because I have seen patients who maybe haven't had an asthma attack in years get in a situation, say perhaps around cigarette smoke, that they could not immediately get out of, and it caused an asthma attack, and they hadn't had one attack in so long they didn't have an inhaler.
Yeah, and I saw that happen on a friend that was traveling and didn't have an inhaler.
Yeah, especially when you're traveling.
Yes.
That's important.
Yeah, thank you. Almost anything can trigger an allergic reaction, and most people are aware of their particular allergy triggers and the reactions that's usually going to occur from that. We're going to have a lot of them to discuss, but just for our viewers, Dr. Conley, would you list some of the various allergens and the triggers that can cause allergic reactions? I mean, you had mentioned dust and mold and some of this, but would you just, there's a whole gamut of them.
Certainly. Well, one of the easiest ways to think of it is by seasons. So in the spring we have the trees, and then the summer mowing season is the grass. Now, the fall, we have ragweed and its friends, so the weeds. Mold is probably the highest in the fall, although really it varies with the weather, and as our weather has been around here, it's hard to say. And of course that's the outdoor mold, and then the indoor factors, if you have an indoor mold problem like a leak or something like that, that's not going to be weather dependent. And then dust, and that is year-round, probably affects us more in the winter because we're in our homes more. Cockroaches. And then the pets and any animal exposure you might have if you farm.
Yeah.
Those are the inhaled type allergens, and then of course food allergies, drug allergies, those types of things.
Yeah, so there's a lot of them.
There are.
Recently, I read that with certain medical conditions, some people are more likely to develop an allergic reaction, and you kind of alluded to asthma and stuff. What are some of these conditions, medical conditions, that someone may have that it would make them more susceptible to, say, an allergic reaction to something?
Well, certainly sinusitis would do that, and allergic rhinitis, and really all of these things that we just mentioned, food allergy and drug allergy, they just all kind of go together. You can almost think of an allergic person as just primed, just a little bit more likely to have an allergic reaction, just because of the way their body composition and the way their immune system sees the world.
Okay, thank you. Several different types of allergy tests are used to identify triggers in order to prevent future reactions. And what are some of these tests that you, as the physician, do, doctor, to identify the different allergic reactions and the allergens?
Well, the simplest things that most people are familiar with would be skin testing. And so we have two types to that. We have one that's on the surface of the skin, and then one that's a little stronger, which is just under the surface of the skin. Sometimes we do blood testing. If particularly, let's say, we're afraid that someone is so reactive that we're afraid to put a certain food, or even it can be grass and dust mites and things like that, on their skin. We can rarely cause a reaction even with testing. One way to avoid that is to do blood testing. Sometimes people might have a eczema or some rash that keeps the skin from being available to us to test, and blood testing works for that.
How do you do the test? I'm somewhat familiar, but some of our viewers may not know. How do you do it, and do you wait a certain length of time before to see if there's any reaction?
Yes. Well, there are different devices, but one of the most popular ones, and the one we use, is just a little plastic piece. It's about this long, and it just has little tips on it, not needles, just little tips, and you just gently touch it to the patient's skin through a drop of the allergen. So
I see.
You put the dust mite drop on there and then touch through the drop. And then you just do that for all the different antigens one by one.
And then how long do you wait to see if
20 minutes.
Oh, it's only 20 minutes. Okay. And then you have a profile.
We have a profile. And then we can follow up with the second part of the test, which is called intradermal. It's with a very small needle, and it's just under the skin. If any of the viewers have had a TB test, it's very much like that. It makes just a little bubble, and then again 20 minutes. And so we can get
almost
so much.
instant.
Yeah, we can get so much information from the skin tests more quickly, obviously, than the blood tests, and that's why we like to start there.
Okay.
If we can.
Okay, good. Before we discuss the specific allergies and their treatment, I would like to discuss some basic things, and these are some of the things that you had suggested that some of our viewers may be interested in. What can all of us do, say, with seasonal allergies, do to help ourselves get through the season more comfortably?
Well, one of the biggest things is to try to be a little bit of a detective and identify when your seasons start every year.
Good idea.
And then if you're able to do that, try to start taking medication at least a couple of weeks before you usually get into trouble. And if it's not too bad, you can just do simple things, over-the-counter medications like antihistamines. You need to make sure you find something that doesn't sedate you, so that you're able to drive and work safely. Decongestants, if you have a lot of congestion, but remember that over-the-counter decongestants by mouth raise blood pressure, so you need to be concerned about that if you have any question of high blood pressure. Those types of things, if you can start those ahead before your allergy season usually gets going full swing, you'll do a lot better.
Okay. So in other words, take some preventive measures or
Yes.
medications,
Yes.
over-the-counter things.
Yes, and if you know that it's your season, then it's better to go ahead and take those at roughly the same time every day, at least for those few weeks.
Okay.
You'll be much better controlled.
Okay.
And perhaps, if you're a little bit more moderate, then whatever medications your doctor has prescribed for you.
Okay.
You're starting that routine ahead a little bit. And a lot of times what I'll do is do a step-up plan. We'll have a certain plan that's our baseline. Maybe we take an over-the-counter antihistamine, and then as we really come into our allergy season, we can add on a steroid nose spray, singular, something like that.
Okay, good. Thank you. There are a number of medications that are available over the counter and by prescription. As Dr. Conley had said, there are antihistamines, oral decongestants, which she mentioned, decongestant nasal sprays, steroid nasal sprays, saline sprays, sinus washes, and also anti-inflammatories. It kind of becomes quite confusing sometimes when we see all these different types of medications. However, Doctor, would you briefly describe how simply or briefly how each one works? The antihistamines, what do they usually do to in the body, and the decongestants and the nasal sprays. And I was interested when you mentioned the steroid nasal sprays, because we always hear that someone should not take steroids for any length of time, because they can be detrimental to the body. Well, not that much, but they can. Would you describe kind of how each one works, please?
Okay, so antihistamines, remember that we had the allergy cell waiting for the ragweed to come in, and the allergy cell released histamine, which causes our symptoms. And there are other things, but histamine's a familiar one that most people know.
Sure.
So antihistamine blocks that response, and so therefore blocks a lot of those symptoms. The decongestant shrinks swelling and inflammation, mainly in the nose and perhaps the eustachian tubes. A lot of people will have that feeling that their ears are clogged, that they're hearing from down in a barrel. Helps with that. The nasal decongestants, so nasal sprays like Afrin, neosynephrine, are very good to stop nasal congestion, but very important caution with those. They should be used only 3 to 5 days at a time, because they cause a phenomenon called rebound, which means they work very well at first, but then the congestion actually gets worse, and the patient keeps using them in an attempt to control the congestion, and it becomes a vicious circle. So that needs to be a short-term use product. The nasal steroids. Now remember, these are corticosteroids, so these are the type of steroids like prednisone. They are not the bad steroids that are illegal, that are destructive to the liver, okay? But having said that, of course, if you take prednisone pills on a long-term basis, if you need to take that for some reason, you will see side effects.
Sure.
The nasal steroids and also the inhaled steroids for asthma, we don't see nearly as much side effect. It's a much smaller dose, and it's going mainly to the inside of the nose or the inside of the bronchial tubes. So it's really not distributing to the whole body like a prednisone pill would, and therefore the side effects are much lower. But, still it's something we watch for.
Okay. We often hear of individuals who have developed a resistance to antibiotics, having taken them over different periods of time and a long period of time. How can someone avoid this antibiotic resistance?
Well, the most important thing to understand is the need to wait when you first get an infection. And the criteria normally is 7 to 10 days to try to let the body deal with that infection on its own. And many of those infections are viral, and of course antibiotics won't change that anyway.
That's true.
And then once that period of time has passed, if the patient feels like they're not getting better or getting worse, then they need to see their doctor to be evaluated about whether or not they need antibiotics. Some of our patients we will start a little earlier because of their history, and because if they do get sick, it acts as a trigger for asthma, and depending on how severe that is, it can be a real problem. So you may have a situation where you and your doctor know, based on your past history, that you need to start a little earlier. But I think it needs to be a community-wide effort, because remember, the germs that we're catching are being passed around among all of us. So if I'm making a big effort not to take unnecessary antibiotics, but you are taking them every time you get a cold, those germs are going to develop resistance, and then they get spread among the community. So we all have to try to make that effort. But it's a difficult line to draw. It really is.
That's an interesting concept, too. I've never heard anyone express it like that, but that's very, very true. Yeah,
it is a community problem. It's a particular problem in Tennessee. We have some of the highest antibiotic usage numbers in this state.
Do we?
In the nation. We do.
That's interesting. Well, thank you for clarifying that. Seasonal allergic rhinitis, also known as hay fever, asthma, hives, and eczema are the clinical disorders most often caused by allergens. However, there are a number of other common allergies that Dr. Conley mentioned earlier, and I would also like to discuss those. Dr. Conley, then there are a number of them, and I'd like to, in the time that we have left, just briefly list each one and have you identify, would you describe the causative agent, what causes it, and the clinical manifestations of it, like symptoms, and then the treatment and medication for each. And I see we're getting close on time. So I'll run through these. The first one is allergic rhinitis or hay fever.
So hay fever is caused by inhalants, things that we breathe in, and treated with a variety of medications or allergy shots, which actually desensitize the patient and cause the immune system to act more like a non-allergic patient.
Okay. The next one's asthma. And that's another whole show, I realize.
Certainly it is. But really, if you think about it, the upper airway, meaning allergic rhinitis, and the lower airway, the bronchial tubes, they are connected. They are one airway. So it is very similar process. Things that are usually inhaled are triggering inflammation. And in the case of asthma, the bronchial tubes can actually get smaller. And so that's what causes the shortness of breath. And so those two problems, the inflammation and what we call bronchospasm, when the bronchial tubes get smaller, is what we're trying to treat. We treat those with inhaled steroids to control the inflammation. Other medications by mouth also for inflammation, like singular accolade if they're milder. And then, of course, the bronchodilators, so to open the bronchi when they're closing.
Okay. The next two, I'll combine those quickly, is hives and eczema.
And hives and eczema are our part, of course, of the rash spectrum.
Yes.
And those are caused by those same mediators, histamine and things like that, except they're under the skin. And so instead of causing congestion in the nose, think of it as congestion under your skin.
Interesting.
Yes.
Yes. Yeah. Thank you. And those medications would be just
some of the same medications, still the antihistamines, but more avoidance, trying to find out what the patient's allergic to when we can. A lot of good skin care. A lot of those problems are caused by dryness.
Next one is food allergies such as peanuts and shellfish, and then also food additives, those two.
Yes, and nobody really knows why we're seeing more food allergy and why the body decides to respond to a certain allergen. So that's one of the things that we're still trying to work out, and there's a lot of.
Do you think it's some of the foods that are changing and the way they're made up or something, or do you think it's just our population?
Well, you know, you would think that maybe some of the processing could have a part in it, but that's pure guesswork. You know, that's really there are things like, for example, that maybe we're a little too clean, that we're not allowing our immune systems to experience enough germs
to build up the antibodies. That's true.
And so there's a lot of interesting theories out there.
Just real quickly, conjunctivitis, which is the eye inflammation.
That's really just the very same process in the eye. the itching, the watering. Eye drops, the allergy eye drops now are really good. So see your primary care or see one of us if you're having a lot of eye symptoms. There are excellent products that are not irritating and are easy to take now.
Medicines such as aspirin and penicillin and things like that, again, we wouldn't know until we have the reaction that we're allergic.
It is very hard to predict.
Yes.
And they don't necessarily run in families in that your mom might be allergic to penicillin, but you might not.
That's true.
Or you might be allergic to aspirin or something like that. So that really is
it's mainly
something that just when
then.
it happens, you need to talk with your doctor. Certainly people that have a lot of chronic sinusitis and nasal polyps, and some patients with asthma are more likely to have a reaction to the aspirin and the NSAIDs like ibuprofen, the non-steroidal anti-inflammatories. So that's something to keep in mind as a general caution for those folks to talk to their doctors about, and if they can take Tylenol for whatever's bothering them, that probably would be safer.
Okay. Now, there were several others that but we're almost out of time, such as latex and animal dander. You had mentioned that earlier, and then the poison plants. But we're almost out of time, Doctor, but I realized that we had to rush through the end of it. But is there something you'd like to emphasize to our viewers before we close about, excuse me, perhaps the different common allergies or something, how they could take care of them?
Well, I guess one of the things I'd like to tell folks is that if you don't respond to the simple allergy treatments, either that over the counter or with your primary care, please come and let's check it out, because what we find in East Tennessee is everyone's told, oh, it's just your allergies, and oftentimes it is, but sometimes it's something else, and sometimes people have suffered for a number of years or perhaps gotten rid of the cat, you know, and it's something else entirely. So if you're not responding, come and let's investigate.
Wonderful. Thank you. And I'd like to thank you for being my guest today. This was so interesting and very informative. Thank you so much.
I enjoyed it. Thank you.
Thank you. And now from the entire Medical Alliance production staff, this is Sheila Whitkey thanking you for joining us today and watching Healthline.